Hello, and welcome to our 5-minute medication review. Today, we're going to be talking about albuterol sulfate. Albuterol sulfate's trade name is Proventil or Ventolin. Its classification is a sympathomimetic and a bronchodilator. So, a sympathomimetic meaning it mimics the sympathetic nervous system. And remember, our sympathetic nervous system is our fight or flight side of our autonomic nervous system. So when we activate or mimic this side of our nervous system, we can expect our heart rate to increase, our blood pressure to increase, and we can also expect a secondary thing, which is bronchodilation. And that's the other class of albuterol sulfate, is it opens up the bronchioles. This medication is carried in our drug box in 2.5 milligrams in 3 ml foil pouches. So these are all in these little foil pouches. We carry 8 of these. And the way that the action or the pharmacology of this medication works is it is a relatively selective beta 2 adrenergic bronchodilator. So basically, what that means is you have two types of beta receptors under your sympathetic control. That is beta 2 receptors, which are located in your lungs because you have two lungs. So beta 2 for two lungs, and beta 1 receptors, which are in your heart. So when you activate these adrenergic receptors, it creates bronchodilation, so widening or opening of your bronchioles. So beta 2 agonists that they relax bronchial smooth muscle, resulting in bronchodilation, and they have some beta 1 overlap with clinically significant cardiac effects such as tachycardia. So remember, if you give maybe too much of these medications, you can have some spillover or overlap into your beta 1 receptors. And remember, I said the beta 1 receptors are in your heart. And so when these get activated, you could see the patient's heart rate start to rise or climb. The other thing is that it actually shifts potassium intracellularly. So if potassium or you are in a hyperkalemic type state, it actually pushes the potassium back inside the cells and results in lower serum potassium levels. So when do we use this? Well, we use it in treatment of bronchospasms, and we use it for treatment of hyperkalemia, and we'll talk about that later. Some absolute contraindications is an allergy to albuterol and some side effects and precautions. So it may cause dizziness, anxiety, heart palpitations, headaches, sweating, and muscle tremors. Clinically significant arrhythmias may occur, especially in patients with underlying cardiovascular disorders, and it's relatively contraindicated. Um, Contraindicated includes symptomatic tachycardias, tachyarrhythmias, or anginal type chest pain. So remember, these are just some precautions and some side effects you could see. Now, we administer this through a small volume nebulizer or an SVN. This can be given, the onset is 5 to 15 minutes. Its peak effect is 1 to 1.5 hours, and its duration is about 3 to 6 hours. And so when you look at the guidelines containing albuterol, it's quite a bit. Okay, so this one, it contains a lot, but a lot of the dose regimens are the same. So follow me here. We can give this for bronchospasms, so asthma, obstructive lung disease. We can give it for anaphylaxis and allergic reactions. We can give it for hyperglycemia, extremity trauma, and dermal chemical burns. So the the doses that respond or that correlate with all of these is truly for bronchospasms. So this is respiratory distress with wheezing or decreased tidal volume. We would give 5 milligrams of this through an SVN as needed. Okay. With anaphylaxis, we can do respiratory distress with wheezing. It's again 5 milligrams in the SVN. With hyperglycemia, okay, so you have a patient who is hyperglycemic. You might be wondering, well, why would I give it for a patient who's hyperglycemic? Well, you would only do that if you're suspecting hyperkalemia with the hyperglycemia, because hyperglycemia or elevated blood sugar levels can cause hypertonicity, and which basically means it can force potassium out of the cells. So remember, another feature of albuterol is pushing potassium back in the cells. So if you're suspecting hyperkalemia, so that means an abundance of potassium outside the cells, you would expect to see peak T waves on your ECG or widening of the QRS as that hyperkalemia advances. The dose for this is the same, 5 milligrams SVN. Same thing with extremity trauma, where you're suspecting hyperkalemia. That's 5 milligrams SVN. And also for your dermal chemical burns, 5 milligrams SVN for hyperkalemia if you suspect it. Thank you for spending time with me today. I hope you learned something.